Hello and welcome to this session on medical ethics. We all know about ethics. In simple words, ethics are moral principles that tell us what is right and what is wrong. They govern our behavior and conduct. Ethics applicable to the practice of medicine are called medical ethics. Medical ethics basically guide a medical practitioner on their conduct in situations that can create conflict between their practice and moral values. We expect doctors and medical practitioners behave responsibly and practice accountability. But the question is what they should do when facing ethical dilemmas. Let us understand this by means of 4 principles: autonomy, beneficence, non-maleficence, and justice. These 4 principles help medical practitioners analyze situations and decide the right or the most appropriate response. Let us understand them one by one. Autonomy means self-rule, which would mean the patients have rights to decide for themselves. Thus, before treating the patient, doctors have to get informed consent from the patient and maintain medical confidentiality. The word inform is particularly important here. It means the patient should fully understand the situation and be aware of their decision. It means the patient should fully understand the situation and be aware of their decision. Let us discuss the principle of autonomy using a case study. A woman enters the hospital's emergency room with extreme stomach pain. She undergoes medical tests and is diagnosed with acute appendicitis. The doctors inform her that the only way to fix the problem is to remove the inflated appendix surgically. They also inform her that the situation is critical and decision has to be taken immediately. For if the appendix bursts, she could die. The woman refuses surgical treatment because of her religious beliefs. Now we have a situation and the dilemma. What do you think the doctors can do if patients refuse treatment? In these circumstances, should the patient be given the right to take decisions or autonomy? Well, the answers are not simple and may vary from person to person. Answer may also vary depending on which side you are or from which perspective you look at the situation. Put yourself into the shoes of the patient or look from the perspective of the third person. You may come up with contrary views, but here we are discussing this from the perspective of a medical practitioner. So apply the principle of autonomy to get the most appropriate answer. The next principle is beneficence. It refers to the actions that promote welfare of others. In medical practice, it means taking actions that are beneficial to the patients and that are based on the patient's point of view as well. Thus, beneficent actions include encouraging a patient to quit smoking and start exercising, or talking to the community on STD prevention. The third principle, non-maleficence, is closely related to beneficence. It means do no evil or cause no harm to others. Most medical treatments carry some risk of harm. Doctors must consider these principles of beneficence and non-maleficence together and produce the net benefit over harm. In day-to-day clinical practice, some non-maleficent actions are stopping a medication that is shown to be harmful or refusing to provide a treatment that has not been shown to be effective. One of the most ethical dilemmas arises in the balancing of beneficence and non-maleficence. A single action may have combined implications of beneficence and non-maleficence. It is referred to as double effect. For example, many treatments may have benefits as well as risks. It's the duty of medical practitioners to share with the patients the information required to understand the scope and nature of potential risks and benefits. This basically is part of getting informed consent. Ultimately, the patient has to take the decision after weighing risks against benefits. However, medical practitioners should always act only if the benefits of an intervention outweigh the risks. Let us now understand the concepts of beneficence and non-maleficence using a case study. A woman was diagnosed with terminal lung cancer. Her doctors inform her that her cancer has reached a stage that it cannot be treated. She is experiencing excruciating pain and asks her doctor to give her medication for pain relief. The issue is, medicine will lessen her pain but hasten her death by causing respiratory depression. Now we have dilemmas here. Can the principle of double effect be used to justify the administration of medication to relieve pain? Does she have a right to make this choice, especially in view of her life expectancy? The patient's family might resist any treatment that might hasten her death. Should their views be considered? Again, answers may vary, but from the perspective of a medical practitioner, the principles guide towards the decision. Now we come to justice, the fourth principle, which refers to equality. The medical practitioner must recognize the competing moral concerns and take fair decisions. Justice requires providing sufficient health care to meet the needs of all who need it, and if resources are limited, then to provide the resources in proportion to the extent of the need of the patients. In day-to-day clinical practice, some examples could be where a doctor believes a patient to be a victim of abuse and the patient is unable to give or withhold consent or disclose. Or the instance could be where without disclosure a doctor would not be acting in the overall best interests of a patient. Or when without disclosure the task of preventing or detecting a serious crime by the police would be delayed. So let us understand the principle through a case study. A man approaches a doctor in a private dispensary with his wife who has head injuries. On being asked how his wife got hurt, he says that she fell down. The doctor suspects it a case of domestic violence because of the nature of the wound. The doctor administers the first aid and is in the dilemma whether to call police. Do you think that the doctor should report the matter to the police? Should the doctor be concerned about the victim, the woman, or the implications of his action on her family life? As a layperson, you may have many views, but as a doctor, you should take the four principles into consideration before reaching any decision. The list of ethical scenarios that healthcare professionals face is endless. In looking for a solution to each case study or ethical dilemma, participants should be guided by relevant moral principles that are autonomy, beneficence, non-maleficence, justice, and the Indian Medical Council Professional Conduct, Etiquette, Ethics Regulations 2002. Hope you enjoyed the discussion on medical ethics. Thank you very much.